Thank you, madam. The next few minutes, I'll just share with the public and also the people who are working in eye care, how important it is for us to improve the screening, which is very important to diagnose a silent killer like glaucoma. We saw the problem. It is the second leading cause. And the other important thing is it is irreversible blindness. The blindness cannot be reversed like cataract or refractory error. And it was beautifully highlighted how a lot of people in our country are not aware because it is asymptomatic. That is why we keep on saying that it is a silent killer. Even a tennis player has lost 70% of his vision to identify this. Then what will happen to somebody like a layman who is doing a normal labor job? So the key is detecting it early. So if you want to detect it early, screening is very important. If you see the risk factors, anybody above the age of 40 can get glaucoma. For example, a diabetic retinopathy will happen only in patients who have diabetes. So we know whom to screen. Whereas in glaucoma, it is difficult to say whom to screen. So that is another question to be answered. And that is why we have a lot of delay even the day we diagnose these conditions because of the lack of awareness, being in rural area without eye care facilities, greater distance from hospital. So these are all some of the reasons for delayed presentation. So when we talk about screening for any disease, even including glaucoma, either you have to do a mass screening where you examine the whole population or do a high-risk screening for people with real high risk for getting the disease, or do an opportunistic screening for people for coming for whatever reasons to the eye hospital, maybe for a near vision glasses or for cataract, or even as a caregiver for a cataract patient. I think it is our opportunity to examine for glaucoma. So we'll have to focus on these two screening in an important way. Because population screening is very difficult because the prevalence is not very high as in other conditions like retinopathy. And even if you have a lot of doubtful cases, you have to do further evaluation and screening, which needs facility. And screening also has to be a continuous. And like what Dr. Panda was saying, there are so many things to diagnose glaucoma. So there is not a single test to confirm it. So it is not very cost effective. So the best way is to do opportunistic screening in some of the places. So I'll share with you our experience, but I'm sure this is what people practice across the country. There are a lot of eye hospitals, primary eye care centers or vision centers, and also eye camps. I'll focus on this high risk. Family members of primary glaucoma should definitely have their eye screened if you are above the age of 30, 35. Because there is a 30% risk for the family member, especially the blood relatives, their son, their daughter, or their brothers of a primary or sisters of the primary patient. So we try to do a very intensive family screening. And I'm sure many of these institutes across the country and hospitals do this. So any primary glaucoma, I think we should try to get that information and give them a SMS or a reminder to register and do a family screening, which is very important, especially in a condition like glaucoma. The other way in most places, how they do is vision centers. So we also have network of vision centers, and many hospitals across India have vision centers. So you don't need a well-trained eye doctor to do this. So you need optometrists or technicians who are trained to do eye examination. So in addition to routine refraction and glasses, they should be trained to check the intraocular pressure. This is how the pressure is checked inside the eye. This gives you an exact measurement. And then you have to check their nerves by dilating the pupil. And this is how the nerve is being checked. But you can also image the nerve. Now there are good low-cost cameras available in the country, like the mobile-based cameras, by which you can take nerves of the patient, which is very important in diagnosis of glaucoma, and it can be transferred through Wi-Fi to the hospital where telemedicine can be possible. And now we have artificial intelligence, which is available. So the image can be immediately, we can see and say whether it is a referable case or it can be seen after some time. So all these facilities are now available in our country, but we need to optimally train people and give these kind of technology to some of these vision centers and eye camps. And also many of the public will know, a lot of eye camps happen for screening of cataract, because cataract is the major reason. But if we can screen little bit more in eye camps for glaucoma and also diabetes related eye problem, we can definitely use that opportunity also, because many of the people who are aged have cataract and they think it is cataract. Even this Kala Motia, they think it is cataract and they delay. So we have to use an opportunity of eye cams to check the pressure like this, like what you see in this video. And also we have low cost cameras which can be used in the outreach, which can again image the nerve, and then the doctor can decide, or an artificial intelligence can decide if the patient needs a glaucoma, further screening and testing in a hospital, so that our screening will be better in some of these areas where we get the opportunity, so that we can beat this invisible disease, the glaucoma. Thank you.